Hello, this is Joan Meakin, CCG Cancer Lead. This is a 2-week wait referral form for gynecology. This form can be imported onto your computer system and will auto-populate with the patient's and GP details. Please use this form for submission of all gynecological referrals that fit the criteria, as this will ensure that patients will be directed to the correct clinic for investigations within the 2-week wait timescale. The forms should be sent electronically and will be managed by the referral support system. At the start of each of the forms are the 3 statements for you to confirm with your patient. For more details about the rationale of the use of these 3 statements, please see the introduction to the 2-week wait referral system YouTube. Here are the criteria for a 2-week wait gynecological referral. A lot of these referrals revolve around postmenopausal bleeding, which is defined as bleeding that occurs more than 12 months after the cessation of regular periods. Any patient over 55 with postmenopausal bleeding and a suspicious scan should be referred. Also, any patient under 55 that has a suspicious scan and postmenopausal bleeding does need referral, but please note that the risk of endometrial cancer in patients under 55 is extremely low, so that if postmenopausal bleeding occurs when the patient is under 55, they should only have a scan requested if they are at risk, such as patients with diabetes or obesity. Please see the management of postmenopausal bleed that is linked to this hyperlink for more details about this. Any patient with postmenopausal bleeding continuing 6 weeks after stopping HRT with a suspicious scan is also another criteria. Postmenopausal bleeding when patient is taking tamoxifen. This patient does not need a scan performing because they're at higher risk by taking tamoxifen. Postmenopausal bleeding that is recurrent and unexplained even if the patient has had a normal scan is also a criteria. A suspicious pelvic mass found on ultrasound or other imaging. These patients should have a CA125 requested and both that result and the scan or imaging result attached with the referral. Any suspicious lesion of the cervix should be referred, and this does not need a smear to be taken. A referral just needs to be done. Again, suspicious lesions of the vagina and vulva are also criteria.